Look, we all strive to be better, and no one's perfect. And I'm not saying that we all have to become super muscular superheroes, but the reality is we can all do better. You can all do better. If you don't exercise, you know it. How many of you have said, I'm going to start a program? Maybe it's Wednesday and you're like, I'm going to start exercising. I need to start exercising. And ultimately what happens to many is the week goes by, they didn't start exercising, and then the weekend comes and they tell themselves, I'm going to start Monday. And then Monday comes and, you know, the fizzling out of any kind of program happens for many, many people. Remember, just in the US alone, more than 60% of the population is obese. And those are alarming statistics considering the cost of obesity on all of you. All of you are taxpayers. If you live in this country legally, you're a taxpayer. And it's not fair for the government to take your money and throw it and enrich in pharmaceutical companies to enrich hospitals and other healthcare groups to the tune of a lack of outcomes. We have the worst health outcomes for chronic inflammatory diseases than any country in the world that has modern medicine. So what does that tell us? It tells us more medicine isn't the answer, and we need to really focus on true and real answers. And I think hopefully the MAHA movement that's coming through the pipeline is going to start helping, you know, create and shape policy around some of the things we're talking about today. Okay, let's look at some research. Skeletal muscle as an endocrine organ. You can see here, besides its traditional function, skeletal muscle has recently been discovered to be an endocrine organ. Myokines, these are chemicals that your muscles produce, are signaling molecules with auto, para, and or endocrine functions that are secreted from skeletal muscles. Between skeletal muscle and other tissues, there is crosstalk, meaning your muscles talk to the other organs of your body. This is one of the problems with specialty medicine. The cardiologist only looks at the heart. The endocrinologist predominantly looks at the endocrine organs, like your thyroid or your adrenal glands. The osteopath or the orthopedic doctor looks predominantly at joints. And so we have this hyper-focused specialty realm that doesn't appreciate the nuance of crosstalk. And crosstalk doesn't just occur from muscles to other organs, it also occurs from other organs to muscles as well. So your tissues talk to each other. You can't divide the body up into parts and understand the holistic nature of how it actually works. And so this is what science is finally catching up to, the wisdom that you can't separate the parts and fix the parts. You really have to look at this holistically. But your muscles communicate to your other organs through chemicals called myokines, and these myokines have tremendous affect. Let's look at some of the things that happen. Blow up this diagram here. You can see from your skeletal muscle, and that's if you have some. Many of you are under-muscled, again, part of the problem. So myokines, there's a number of different types of myokines, but they have many different types of functions. So some myokines travel to bone and inhibit bone loss. Some travel to breast tissue, ladies, and inhibit the growth of cancer cells. Have you ever heard an oncologist say, if you've got breast cancer, you need to go start exercising as part of your health plan? No. They want to dose you with chemo and radiation and put you on tamoxifen for 5 years. No communication about exercise. Exercise, myokines, reduce cancer growth. We know that the muscle speaks to the pancreas. It speaks to the pancreas and it increases GLP-1. Now, how many of you are out there taking Ozempic right now? You know, there's a whole body of people pumping this drug in themselves to lose weight. It's what we call an exercise mimetic, so to speak. It's the drug that takes the place of the physical activity, but not really, because this drug doesn't, unfortunately, it doesn't come without consequence. We see intestinal problems, increased risk for cancer, pancreatic failure, among other problems. So muscle does this for free. And, you know, this is the other thing. These drugs are very expensive. And again, our healthcare system is subsidizing people getting on these medications. And what we should be doing is subsidizing the exercise. Hospitals should have gymnasiums. You really want to think about it that way. Hospitals and doctors' offices should have gyms in them where people can come to exercise. If we're really going to take healthcare seriously and really induce a sense of exercise as the important first step in reclaiming your health. Okay, back to this. We know that myokines can talk to your gut, also increasing GLP-1. So again, what everybody's after with these drugs. but it also suppresses colon tumorigenesis, which is cancer. It suppresses the development of colon cancer. We know that myokines go to the liver and to the fats. This is white adipose tissue, WAT or WAT, and then down here this is brown adipose tissue. But we know there are a number of different impacts on fat tissue. It increases the breakdown of fat, increases glucose uptake, and increases thermogenesis, which basically helps you to burn more calories and to burn fat as a source of energy. We know that myokines can travel to the brain, and it can enhance learning and memory, and can increase hippocampal BDNF. BDNF is a type of hormone. It's in a family of hormones that help with growth and help with healing and repair. So, numerous functions and numerous organ crosstalks amongst the muscle chemicals, the myokines, if you will, and your tissues. Then we have this paper here on muscle organ crosstalk, the emerging role of myokines. And you can see here just some additional examples, probably a little bit easier to understand in these examples, but promotes endothelial function and revascularization. So it helps your blood vessels work more efficiently and more effectively. It improves the skin, the health of the skin, reduction of aging. And it's really not a reduction of aging so much as it is a graceful aging. So many people age more rapidly. If you look at people, as a general rule, who don't take care of themselves, they look older than people who do. And this is part of that, and that is impacted by myokines. We know that through the brain it increases BDNF, which helps to regenerate nerves. Neurogenesis is the growth of new nerves. We know that it also helps to control appetite so that you're not prone to wanting to snack and overeat. I remember when I was a kid, they used to have these commercials. I think it was Schoolhouse Rock, but it was the munchies, and there were these little evil-looking critters called the munchies. And so the commercial was a cartoon warning kids about the munchies and saying, if you have the munchies, go outside and play, go outside and exercise, and the munchies will go away. We don't have that anymore. Now it's here's your device. If you've got a crying kid, it's like put an iPad in their hand, and that's their new babysitter. There's a lot of, in my opinion, there's a lot of, well, we won't go there, but poor parenting that does occur. And I don't think it's necessarily poor parenting. I don't think it's parents doing it out of mislove. I think it's parents doing it out of convenience. And I think we do a lot of things out of convenience without thinking about the long-term consequences. We know bone formation. We know hepatic glucose production, so it aids in blood sugar regulation. We know it helps the pancreas secrete insulin, and we know it helps the gut secrete GLP-1. The adrenal gland, it helps to regulate cortisol and white blood cell production. Lymphocytes and neutrophils are white blood cells. We know that in macrophages, it reduces the inflammatory nature. That's these two chemicals here, interleukin 10 and interleukin 1RA, are what are also known as immune chemicals that regulate inflammation, and these two happen to be anti-inflammatory. And then TNF, tumor necrosis factor, it reduces that one, and that one's an inflammatory chemical. So it reduces inflammation. Muscle building, muscle itself, just the act of having it, has all of these functions and benefits, and all you have to do to take advantage of it is put some on your body, right? Exercise. So you can see here, exercise may be prescribed as medicine. Now, let's circle that. Let that sink in. Exercise may be prescribed as medicine. It should be the primary medicine. Exercise, sunshine, sleep, and clean diet should be the primary medicine being prescribed before any such drugs can be prescribed. That's my opinion. But anyway, exercise may be prescribed as medicine for lifestyle-related disorders, which is, well, what is a lifestyle-related disorder? It's every chronic inflammatory condition that exists. Type 2 diabetes, dementia, cardiovascular disease, and cancer are listed here as examples. But we know that skeletal muscle works as an endocrine organ which can produce and secrete hundreds of myokines that exert their effects in either autocrine, paracrine, or endocrine manners. Recent advances show that skeletal muscle produces myokines in response to exercise, which allow for crosstalk between the muscle and other organs, including the brain, the fat, the bone, the liver, the gut, the pancreas, the vascular bed, and the skin, as well as communication with the muscle itself. So get some of that. You know what? It's free. That's the other thing. We could say, okay, a gym membership costs money, but push-ups don't, squats don't, sit-ups don't. A jump rope will cost you a couple dollars. If you have one at home, you can do jump rope. Plank holds don't cost you any money. Like physical activity, playing doesn't cost money. It just takes time. And I think that's the thing. We have to refocus our time, efforts, and energy on the things that are going to move the needle. Okay, this was published in the journal Physiology, but you can see here some of the things that lack of activity, lack of physical activity are linked to. So you get the absence of emotional highs. There are chemicals that are released in enkephalins and endorphins after exercise that make us happy, that also regulate pain. Many of these chemicals have pain regulatory effects. This is why people with chronic pain like fibromyalgia and chronic fatigue syndrome would benefit from the exercise. Less blood flow, less executive control and memory, loss of neurogenesis, so they don't make nerves in the brain as effectively. They start to lose coordination and balance, less endorphin release, smaller frontal and superior lobes as you age, breast cancer, non-alcoholic fatty liver disease, blood pressure and cardiovascular risks, poor immunity, type 2 diabetes, erectile dysfunction, ladies and guys, osteoporosis, loss of structure and function of joints. I think it's important to side note here. Joints themselves do not have a blood supply. And the way they get nourishment is through synovial fluid. So there's that clear viscous fluid, it's called synovial fluid, is what bathes the cartilage in your joints. It bathes that cartilage, and when you're sedentary, that fluid doesn't move, and that cartilage, when you're sedentary, starts to deteriorate. But when you move that joint, it forces that synovial fluid to bathe that cartilage in nutrients. So how does that because it doesn't have a blood supply. So how does it get nutrients? Through the forced pressure motion of movement, pushing synovial fluid nutrients into that cartilage. This is what prevents arthritis. This is what prevents tendons and joints from becoming prematurely injured with minor activity, right? So loss of structure and function of joints, which is what a lot of people suffer from. How many of you are taking ibuprofen or Tylenol or other NSAIDs or prednisone or other drugs to reduce joint pain on a daily basis? Exercise, it's the freest medicine in the world, and it doesn't come at a cost. It doesn't, other than your time, it doesn't come with consequence. We also know reduced skin wound healing occurs with lack of activity and lack of movement. Alzheimer's disease or dementia, depression, stroke, incidence, and poor recovery, all linked to low exercise. Congestive heart failure, endothelial dysfunction, this is blood vessels. We'll talk more about this in a moment, but exercise allows for nitric oxide release, which dilates your blood vessels, reducing the risk of heart disease. We know ischemic events, which is heart attacks and strokes, etc., inflammation of the vascular wall, lower maximal cardiac output and lower cardiac reserve, and a lower max VO2. So all these things happen, again, without exercise or activity. We know it contributes to visceral obesity or weight gain. That's the weight that grows, or the fat that builds around your organs, especially your heart and your abdomen. We know colon cancer, as I mentioned earlier, and then loss of neuromuscular strength with aging. This isn't the thing of aging. It's like the doctors want to blame this stuff on you getting older. In reality, it's not you getting older. It's you being sedentary over time. When you multiply sedentary behavior over time, you get the side effects of what doctors like to call aging, but in reality, it's just sedentary behavior causing a reduction of your body's resources to want to rebuild. Remember that use it or lose it philosophy applies here. When your body isn't being physically worked, then your body doesn't prioritize the healing and the repair of the organs and the tissues. We know that lack of activity leads to diabetes through reduced glucose uptake and insulin sensitivity. We know that reduced oxidative capacity and skeletal muscle atrophy with aging. Again, not with aging. They have a name for this. They try to diseaseify everything, and not that way you don't have to take personal responsibility for this. But sarcopenia is not a disease. It's just a term that doctors came up with to make people feel comfortable with not exercising. You don't have a disease when you have sarcopenia. What you have is muscle atrophy that's related to disuse over time. It has nothing to do with age, it has to do with sedentary behavior. And then blood pressure, increased arterial stiffness, and peripheral artery disease. So what do we get when we don't move? We get a reduced quality of life and we get a premature death. Now, in the process of that reduction of quality, so when you put these two things together, the life cycle as you go through it, what's the input? What is the medical input is drugs, right? So what is the purpose of these drugs? It's to improve the quality of life through symptom management, right? And these drugs, they come at a tremendous cost, not just financially. So there's a dollar sign cost to drugs, but there's a side effect cost to drugs that very rarely gets discussed. As a matter of fact, there's newer research coming out now. The most recent study that was published in the British Medical Journal found that prescribed medication, purposefully prescribed for the right reason, is the third leading cause of death. And that's pretty alarming when you consider that heart disease and cancer and cardiovascular metabolic conditions are number 1 and 2, but then the way we treat them is number 3. And what we should be doing is exercise treatment first.